Walking pneumonia, also known as atypical pneumonia or Mycoplasma pneumonia, is a mild form of pneumonia caused by the bacterium Mycoplasma pneumoniae. It is often mistaken for a common cold or bronchitis because it causes similar symptoms such as cough, fever, headache, and fatigue. However, walking pneumonia can be more severe than a cold or bronchitis, and it can also be contagious. Symptoms of walking pneumonia. The symptoms of walking pneumonia are often mild and similar to those of a cold or bronchitis. They can include cough, which may be dry or productive, fever, usually low grade, less than 101 degrees Fahrenheit, sore throat, headache, fatigue, chest pain. How is walking pneumonia spread? Walking pneumonia is spread through respiratory droplets that are released into the air when an infected person coughs or sneezes. These droplets can be inhaled by others or can land on surfaces and be picked up by the hands and then transferred to the mouth or nose. Who is at risk for walking pneumonia? Anyone can get walking pneumonia, but it is more common in children, teenagers, and young adults. People with weakened immune systems, such as those with chronic lung disease, HIV/AIDS, or cancer, are also at increased risk of getting walking pneumonia. How is walking pneumonia diagnosed? There is no single test that can definitively diagnose walking pneumonia. Doctors will usually diagnose the condition based on a combination of the patient's symptoms, medical history, and physical examination. They may also order a chest X-ray to rule out other causes of the patient's symptoms. How is walking pneumonia treated? Most people with walking pneumonia will recover without the need for antibiotics. However, if the patient has a fever that persists for more than 3 days, has difficulty breathing, or has a history of severe lung disease, they may need to take antibiotics. What can I do to prevent walking pneumonia? There is no vaccine to prevent walking pneumonia, but there are some things you can do to reduce your risk of getting it. Wash your hands frequently with soap and water, especially after being around sick people. Avoid close contact with people who are sick, especially if they have a cough or cold. Cover your mouth and nose when you cough or sneeze, and throw away used tissues. Get plenty of rest. Eat a healthy diet. Exercise regularly. When should I see a doctor? If you have symptoms of walking pneumonia, see your doctor to get a diagnosis and treatment. It is important to see a doctor if your symptoms are severe or if you have a weakened immune system. Will walking pneumonia turn into another pandemic? There have been several reported outbreaks of walking pneumonia, also known as atypical pneumonia or Mycoplasma pneumonia, in recent months. These outbreaks have been particularly severe in children and have been linked to the Mycoplasma pneumoniae bacteria. China. In November 2023, a cluster of undiagnosed pneumonia in children was reported in northern China. The outbreak affected over 20,000 children and led to several hospitalizations. The cause of the outbreak was initially unclear, but it was later linked to Mycoplasma pneumoniae. These outbreaks have raised concerns about the potential for a global outbreak of walking pneumonia. However, it is important to note that the outbreaks have been relatively contained so far, and there is no evidence that they are spreading beyond the countries where they have been reported. The cause of these outbreaks is not fully understood, but one possible factor could be the increased number of people who are now susceptible to Mycoplasma pneumoniae infection. This could be due to the COVID-19 pandemic, which has led to a decrease in the number of people who are exposed to other respiratory viruses, such as those that can help protect against Mycoplasma pneumoniae infection. Another possible factor could be the fact that Mycoplasma pneumoniae is becoming more resistant to antibiotics. This could make it more difficult to treat outbreaks of the disease. It is important to stay up to date on the latest information about walking pneumonia outbreaks. If you are concerned about your child, please consult with your doctor.